We're looking live at Times Square again in New York City, and those great big billboards continue to show all their messages and their ads, but very few people there to see them. As you can see, just a couple of police vehicles, a couple of people in the square. Of course, New York City is ground zero again, and by far the biggest pandemic hotspot in the United States. The U.S. itself has overtaken China now as the country with the most cases of the virus. It is the new global epicenter. 85,991 confirmed cases in the United States. That's the latest number from Johns Hopkins University. So more than China. New York is a focal point. Louisiana is a focal point because of big Mardi Gras celebrations, and that state really starting to see the numbers spike. So as we watch the United States and the cases rise and continue to watch the daily coronavirus task force briefings, you hear the message from the United States President Donald Trump appearing again to be minimizing the impact, and in particular in New York, in the state of New York. Let's go to our senior Washington editor, Lindsay Duncombe, who has the latest on the U.S. situation. Lindsay, good morning.
Good morning, Heather. It was interesting listening to the president after the briefing yesterday. He did a phone interview with Fox News host Sean Hannity. And in that interview, he appeared to question the repeated requests for additional ventilators coming from the states, particularly Governor Andrew Cuomo of New York. Here's what Donald Trump said to Sean Hannity.
And, you know, they'd say, like Governor Cuomo and others, they'd say we want 30,000 of them. 30,000. Think of this. You go to hospitals, they'll have one in a hospital. And now all of a sudden everybody's asking for these vast numbers.
This comes as the White House task force on coronavirus is pushing back on these reports of there not being enough ventilators in New York. Dr. Deborah Birx pushed back on that a little bit in the briefing yesterday, saying that while in denser areas there may be need for more ventilators, what's happening is in parts of the state that have beds that are open and do have ventilators, they can move those pieces of equipment to where they're needed. She seemed to be upset by the kinds of reports that are coming out in the media in that state. Here's what she had to say.
To make the implication that when they need a hospital bed, it's not going to be there, or when they need that ventilator, it's not going to be there. It's our collective job to make sure that doesn't happen.
And an interesting development on the issue of ventilators. The New York Times has a report this morning that there is a deal between the federal government, General Motors, and Ventec, which is a medical company, that they have been in talks to start mass producing ventilators, as many as 80,000, that the White House had been prepared, according to this report, to make that announcement on Wednesday. But that's been delayed according to the report because of cost, which would be $1 billion. The sense now is that that deal could still happen, could be announced, but that the White House and FEMA are looking at other options, other vendors, other offers, as they try to figure out how to meet the anticipated supply, even as the White House pushes back.
Lindsay, thank you very much. Our senior Washington editor, she is right there at her new home office. Lindsay Duncombe, thank you very much.